Sirolimus, also known as Rapamune Tablet, is used in combination with other medications to prevent the rejection of a kidney transplant. This medication is classified as an immunosuppressant and works by weakening the body's defense system, also known as the immune system, to help the body accept the new organ as if it were its own. In addition to its use in preventing kidney transplant rejection, sirolimus may also be used to treat a certain lung disease called lymphangioleiomyomatosis, or LAM. It is important to take the prescribed dosage of sirolimus at the same time every day, and it can be taken with or without food. Be sure to follow your doctor's instructions on the best time to take this medication. Before taking Rapamune Tablet, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. Swallow the tablet whole, do not crush, chew, or split it. If you experience nausea or an upset stomach, you may take the medication with food, but it's important to choose one way and stick to it for every dose. The dosage is based on your weight, medical condition, lab tests, and response to treatment. Remember to take this medication regularly at the same time each day to get the most benefit from it. Do not increase your dose or take it more often than prescribed, and do not stop taking it without consulting your doctor. If you are also taking cyclosporin, take sirolimus 4 hours after your cyclosporin dose. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it's safe to do so, as grapefruit can increase the chance of side effects. If you are taking this medication to treat LAM, tell your doctor if your condition worsens. Common side effects of Rapamune Tablet may include diarrhea, joint pain, shaking, acne, or trouble sleeping. These effects may improve over time, but if they persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as nausea/vomiting, yellowing of the eyes or skin, dark urine, muscle or bone pain, increased thirst or hunger, frequent urination, hearing problems, unusual tiredness, irregular heartbeat, easy bruising or bleeding, changes in mental/mood, swelling, severe headache, dizziness, abdominal pain, signs of kidney problems, or pain/swelling in the arms or legs. In rare cases, this medication may increase the risk of a serious brain infection, PML. It's important to seek medical help if you experience symptoms such as clumsiness, weakness, changes in thinking, difficulty talking or walking, seizures, or vision changes. Additionally, sirolimus may slow wound healing, especially in obese individuals, and can also cause an increase in cholesterol and triglyceride levels. It's important to monitor these levels and inform your doctor if you notice any changes. While sirolimus can cause a rash, it's usually not serious, although it may be difficult to distinguish from a rare and severe rash. Seek medical help if you develop any rash or allergic reaction, such as itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Sirolimus, also known as Rapamune Tablet, reduces the body's ability to fight off infections and diseases, which is called immunosuppression. This means you may have a higher risk of developing an infection or certain types of cancer, such as skin cancer or lymphoma. To lower the risk of these serious side effects, take this medication at the lowest effective dose as directed by your doctor. It's important to keep all your medical and lab appointments. If you notice any unusual skin changes, changes in the appearance or size of moles, unusual growths or lumps, swollen glands, night sweats, unexplained weight loss, or signs of infection like a persistent sore throat or fever, it's important to tell your doctor right away. It's important to note that sirolimus is not recommended for preventing the rejection of liver or lung transplants because it has rarely caused very serious, possibly fatal, liver or lung problems in those cases. Always follow your doctor's instructions and let them know about any concerns or side effects you may be experiencing. Before taking Rapamune tablet, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have liver disease, high cholesterol/triglyceride levels, cancer, or any recent/current infections. Rapamune tablet may increase your risk of getting infections or make current infections worse, so it's important to stay away from anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or the flu. Also, inform your healthcare professional if you are using this medication before having any immunizations/vaccinations, and avoid contact with people who have recently received live vaccines. This medication may also increase your risk of developing skin cancer, so it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Rapamune tablet can also affect fertility in males, so it's important to discuss this with your doctor. If you are pregnant or plan to become pregnant, you should not use this medication, as it may harm an unborn baby. Ask your doctor about reliable forms of birth control while using this medication and for 12 weeks after the last dose. If you become pregnant, talk to your doctor right away about the risks and benefits of this medication. Finally, this medication may pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding while using this drug. It's important to be aware of potential drug interactions when taking Rapamune tablet. Certain medications may change how Rapamune works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Rapamune include ACE inhibitors, other drugs that weaken the immune system or increase the risk of infection, and other medications that can affect the removal of sirolimus from your body, such as certain antifungals, antibiotics, and HIV protease inhibitors. It's also important to note that sirolimus is very similar to temsirolimus, so medications containing temsirolimus should not be used while taking Rapamune. Be sure to follow your doctor's guidance and take Rapamune as prescribed for the best results. If you or someone else has taken too much Rapamune tablet and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while in Canada, you can reach out to a provincial poison control center. Remember to attend all your medical and lab appointments to monitor your kidney and liver function, as well as cholesterol and triglyceride levels. Your doctor may also want to check your urine for protein and your sirolimus trough level while you are taking Rapamune tablet. If you have had an organ transplant, it's important to attend a transplant education class or support group to learn about the signs of organ rejection, such as feeling ill, fever, or tenderness/pain around the transplanted organ. If you notice any of these signs, be sure to tell your doctor right away. If you forget to take a dose of Rapamune tablet, take it as soon as you remember. If it's close to the time for your next dose, then just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing Rapamune tablet, make sure to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. Also, remember not to flush the medication down the toilet or pour it into a drain, unless specifically instructed to do so. When the product expires or is no longer needed, be sure to properly discard it. It's best to consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.